Over the past few months, I've been focused on this concept of spike detox. And when I talk about it, some people perceive it almost as some kind of conspiracy theory. And no, I am very interested in the post viral manifestations around COVID, because that's where one part of where the spike protein comes from, as well as the fact that any source of spike protein could potentially trigger similar kinds of responses. And so, in this search to try and understand what's happening and critically to find solutions, because there are so many people who are struggling, and you will know if you are struggling, if you are having ongoing symptoms. I've already gotten so many responses from people who are concerned about their health, concerned about spike protein exposure. Make sure that you look in the description and click on the link, fill out the survey, and you will join into us as we search for solutions. So, in this process of searching for solutions, and I'm recently in discussions with a company internationally who is looking at trying to identify ways of testing and potentially having solutions. I think this is huge. And so anybody who is in this space, I think, is very, very relevant. And one of those people that I interacted with recently, looking at this as well, is Rachel Jessey. And you'll understand a little bit more about her in a minute. Rachel, I just want to start off and ask that you do a quick introduction for yourself.
Yeah, hello. Thank you for having me on, Philip. My name is Rachel Jessey. So I am trained as a nutritionist. I've been working as a nutritionist for the past 15 years, and I'm also qualified in naturopathy as well. And I have in that time been dealing with a lot of chronic health conditions in that time. So I took over from quite a well-known nutritionist back in 2010 who already had quite an established clinic in chronic health. So I was very much kind of catapulted into this really complex healthcare space. Now, what I found happening when the pandemic hit was that standard interventions were just not working in the same way that they were. People weren't tolerating things as they usually were. This kind of standard functional medicine model that we apply in clinical practice was just not producing the results, and people were coming with this really strong level of chronicity. Now, I very much started to look at the gut microbiome within this from the start of the pandemic and noticed there were very specific trends happening. And when I started to post my research out on LinkedIn, this is when I kind of gained a bit of attention and connected with people like Dr. Philip McMillan here, but also people like Carlo Brogna, who have been doing a lot of research in this space. So yes, my clinical practice has evolved around the gut microbiome, also the interplay with the oral and the nasal microbiome, but also there are other things that have grown and developed in my clinical practice. And really, I take a kind of 360-degree view of people's health when they come to consult with me in clinical practice now.
Excellent. And listen, I'm going to ask you an important question, Rachel, because I'm curious about this. You apparently deal with celebrities as well, don't you?
I do. I deal with a number of different clients from all backgrounds, but yes, I have a portfolio of celebrities.
What's that like? What's that like?
I think when I first started working with people, I was really super nervous. You kind of see these people as almost, well, some of them I'm actually a complete girl fan, complete fan of these people, and so super nervous going in, and it's really, really hard to kind of, it was hard at the beginning to kind of differentiate the professional with the, oh my goodness, I'm speaking with so-and-so here, but it was very, very quickly apparent that, these people are just the same as everyone else. They are experiencing exactly the same challenges. And it's just normal now. It's just like any other person.
And when you think about that, because there are a lot of people who are struggling, when we consider that it's not just the average person, these are people who have all the resources available to them, and they are still struggling to find solutions.
Yeah.
What does the average man in the street do?
Yeah, well, this is the thing, because when you actually, now the majority of people that are coming to me, we're 5 years down the line now. So a lot of people have spent literally thousands, and this is not just celebrity clients. These are people who are struggling, trying to find the answers to their chronic healthcare or their chronic condition. So yeah, I get a long list of symptoms that people are experiencing, a long list of medications that people have tried, a long list of supplements, but the amount of money that has gone into testing is absolutely astronomical.
When I think of this condition, and I am careful because I don't like the term long COVID. Long COVID means nothing because there's so many things that mean long COVID. And
Yes.
so there are a lot of people who don't even believe that it exists. And this is not just the general public. I'm talking about clinicians as well. I think I would say, in my estimation, 60% barely think about it, much less the label it as anything. Some people strongly believe that it's just functional, meaning that it's in the person's mind. Um, and the general public oftentimes don't know that this is actually a diagnosis. And
Yeah.
so there is a lot of misconception around long COVID. When I do the research, and I'll ask you your thought on this, my description of what I call pure long COVID is a condition that appears after mild or very asymptomatic COVID infection, or in some people within a few days or weeks of a vaccination, that persists for easily over 3 months to many years with chronic symptoms, for which fatigue is a big one of them. And I differentiate that from people who had severe COVID, not that they can't have long COVID features, but if they had heart damage, kidney damage, lung damage, that's not long COVID. That's a consequence, that's a complication
Yeah.
of a severe cytokine storm.
Yes. Yeah. And we see that playing out in sepsis as well. So someone who has had a sepsis event that has required very significant medical intervention will potentially come out of that with this kind of post sepsis kind of symptom, but it will be located in specific areas very similar to what we're seeing play out in severe COVID. And with regards to that long COVID trajectory, I think there's so many things going on there. And this is where we can kind of start to pull on Carlo Brogna's research, because I do feel a lot of the interactions that happen between that interplay with our internal or our external and our internal environment is happening within the microbiomes. And it's just really interesting to me that Carlo Brogna actually was able to identify bacteriophage replication, Clostridia, toxic peptides, all of these things really becoming apparent with regards to the interactions in the biomes.
Yeah, and just in case people are not aware, is that Carlo Brogna, he's an Italian doctor who had been doing a lot of research on COVID, and he found some really fascinating things from 2021. And not to raise a conspiracy theory here, granted, I'm raising a conspiracy theory, but the bacteriophage characteristics of the virus, and just so people understand what I mean, the virus not only infects human cells, but seems to have the capacity to infect specific bacteria and cause them to change their function. This is like nothing we have ever seen before, or if it had occurred before, we were not aware of it. This is doing it at a completely different level. And so this research, which was known since 2021, has really gotten no traction. So few people are even aware of this, even in the clinical community. Why do you think that's so?
It's lack of understanding of how powerful the gut microbiome is, and how the gut microbiome can interact with many different pathways. Now, I think I had a slide. I don't know if you're able to get it up at all, Philip, but it was one of the slides that shows you, the gut microbiome metabolites in particular that relate to the gut-brain axis. There are absolutely, this slide here, you can see here from this research, which was a massive collection of data from all the research that has been pulled within the gut microbiome up to about 2022. And you can see here, all of these metabolites in this slide are actually produced within our gut microbiome. So there's things that you're going to see that you will recognize in there. So we have certain peptides, we have serotonin, the tryptophan pathway is all managed through the gut microbiome. We're producing vitamins, we're producing key metabolites which are important for not only our immune system function, but also that really important gut-brain function, or that gut-brain axis function. And I remember when this research broke of Carlo Brogniar's, and it was immediately shut down, and I got really frustrated, because I was like, we're seeing this happen in vitro. This is a really important mechanism. And what I felt that it was happening, and what it seems to be playing out like in clinical practice, is that it's this particular bacteriophage activity is taking down keystone bacterial species, such as Lactobacillus species and Bifidobacteria species, which again have really key important roles within the gut-brain axis, the gut-liver axis. They help with our metabolism, so making sure that our body doesn't trip over into chronic health conditions such as diabetes, for instance. So for me, the bacteriophage presents an interesting first stage concept with regards to some of the dysregulation that we see within the gut microbiome.
One of the things that also we have to be concerned about, I don't know if you've noticed this, is I know Sabine Hazan, so she's a gastroenterologist in California, and she had a paper looking at the microbiome changes after vaccination as well. Occurring. Is that something you would see in terms of clinical work?
Yeah. I'm not able to differentiate between vaccination damage to the gut microbiome and actual COVID infection damage to the microbiome. Sabine Hazan has got very specific technology that she's been using to assess the gut microbiome, and she has absolutely been a huge advocate for driving the information forward with regards to particularly the Bifidobacteria species. So that's where she's been primarily focusing on. And her research is really kind of warning people that if we lose this really important keystone bacterial species, we may likely never get it back. And that's going to have really severe and serious consequences on overall health.
When you look at, this is one of the slides that I have, which one, sorry, this one here, we're not quite sure whether or not it's lipid nanoparticles, whether or not it's just free floating spike protein interacting with bacteria or the virus itself. But all we know is that these, especially the Clostridia species, seems to be weaponized in a way that we have never seen it before to produce toxins that destroy all the other bacteria. This is like unprecedented stuff.
This is for me quite a scary interaction that is going on within the gut microbiome. So toxic peptides, just to kind of give people an idea, they are going to be released within the gastrointestinal tract, and they're going to have a specific interaction with regards to the gut mucosa. And what we're seeing play out in clinical practice from my perspective is that you're starting to see a degradation of the really important mucous membranes of the gut. This is where you can start to see people reacting to food particles. So we see a lot of histamine intolerance in clinical practice because of the degradation of the microvilli that could be potentially related to this inflammatory process. We have seen some people tripping over into things like inflammatory bowel conditions, but equally, we then end up with this situation where people can start to translocate or start to displace the tight junctions that keep our cell membranes or our cells really close together. And once we start to activate the immune system responses within the gut, we bring in, we start to activate that through lipopolysaccharides, which are on these gram-negative bacterial species. We then start to bring in toll-like receptor 4. And this is where we start to see all of the inflammatory cascades that we see in this presentation occurring. So there are multiple things happening within the gut. But if the Clostridia is doing this, which I suspect it probably is in some people, then this is something that needs to be targeted.
Yeah, I've got here. I hope it can be seen. This is what he found with the and in case you can't quite see it, that they looked at it day 0 to day 30 in dark blue, and you can see the Clostridia species almost doubling. E. coli goes up and comes down.
Yeah.
The other ones, but the overall gut flora increased in that period of time. And critically, when you then looked at the gram positives, you know, I think, for instance, bifidobacteria was almost completely wiped out. This is it here.
Yeah.
You know, bifidobacteria completely wiped out.
Yeah.
Rhodococcus completely wiped out.
Yeah.
Lactobacillus significantly decreased.
Yeah.
You know, how does the public understand the implications of something like that?
It's going to be education and awareness. It's going to be bringing people together who are doing the testing, doing the research on this, and we need to form alliances and collaborations. And this is something that I've been hugely pushing all the way through, because for all the will in the world, I'm only one person in clinical practice. The data that I'm getting through is quite consistent to what Calibronia's research is finding. I feel that the gut microbiome has the ability to recover. I think the gut microbiome is much more clever than we are actually led to believe. I think it works in almost a quantum mechanics type way. So it's interacting with our internal or external environment. It's sensing light, it's sensing water, it's sensing electromagnetic fields. And I think this is why this virus and this technological platform of mRNA has potentially had such a detrimental impact. That being said, I do feel that we could look at the gut microbiome in a different way and think about it in the context of what is happening. Is this an evolutionary thing that needs to happen to deal with what's going on in the gut? Or do we need to intervene and correct what's happening in the gut? So
Yeah, these are some big questions, and I can't think that overgrowth of Clostridia, because in the hospital environment, Clostridia is a big issue. You know, C. diff cases going up, and we've seen this across the world.
It does depend on what Clostridia species it actually is as well, because some species can actually have a beneficial effect as well.
So based on what you're seeing, though, which ones are growing? Is it the good ones?
Yeah, my tests don't differentiate. Obviously, I can test for C. diff. That would come out on certain testing, but it's generally the beneficial bacteria, Clostridia species, that I'm seeing overgrowing in the gut microbiome. But that's not differentiating between the specific species, unfortunately. And this is where we need to do a lot more research on that particular species.
So when we think about the toxin production, and just so again, what Carla Brogna found, I think it was about 36 new toxins being produced. And because the Clostridia are growing within 30 days, I think it's a reasonable supposition to say that the Clostridia species are producing more effective toxins at destroying the other, what we would call good bacteria. I can't see how this is any way beneficial across the population.
Yeah. And this is where the research needs to be done, because what's really important to understand about the gut microbiome is that it is not just about single species. It's about what's happening to the rest of the structure of the gut microbiome. And granted, yes, Clostridia is a really dangerous and a bacteria that we don't particularly see diff. We don't want to be seeing that overgrowing. We don't want to see toxic peptides in the gut either. We don't want to see the takedown of keystone bacterial species. But there are potentially other things happening within that gut microbiome as well that we still don't understand. And then the other thing that we need to think about is, what's the interaction between the oral, nasal, and the gut microbiome? There is a skin gut microbiome axis going on as well. So all of these things really need to be looked at carefully with regards to, okay, if we're going to be targeting Clostridia, how do we then build back these microbial species as well?
You know, one
The
of
intervention step by step. Yeah.
one of the things, strangely, I woke up this morning, and for some reason, I'll put this presentation together. I've been thinking about Mr. Beast. He's a YouTuber, and he's got Crohn's disease. I'd been listening to a DOAC interview, and I was thinking to myself, based on all of this stuff going on, let me think about Crohn's a bit, and let me think about what could be some mechanisms. And it was because I was thinking about this for the past few days. I then woke up this morning, and suddenly what popped into my head was fungal overgrowth.
Yeah.
Okay. Because there is a very close interaction between bacteria and fungal, because they both utilize similar pathways for energy and nutrition and growing. Any observation about what is happening with gut fungal growth? Anything?
Yeah, so I see it coming up quite a lot in clinical practice. We can test for fungal species in the stool, and we can also run metabolomics in the urine to see whether people are producing specific metabolites that point to a fungal overgrowth. And invariably, we see this coming up quite a lot. Now, the interesting thing with fungal species is that they can start to hijack the citric acid cycle, so they can actually kind of pull on the energy reserves and use it for its own benefit, so to speak. Now, what's really interesting is these keystone bacterial species that are being wiped out are there to help control the overgrowth of fungal bacteria or fungal species. So, you know, typical thing, you put people on long-term antibiotics, it provides the fungal and the yeast the opportunity to grow and develop. And it's a kind of similar thing potentially that we're seeing happening in the gut microbiome. So you're taking out these keystone bacterial species, you're reducing down the protection that it would give to kind of keep these other microbial species at bay. Again, we don't want to be completely eradicating yeast and fungal species, because they do have a role to play within the whole gut microbiome. But absolutely, yes, definitely seeing that play out in clinical practice. And again, coming back to again, what these keystone bacterial species do, they provide food and nourishment for the lining of the gastrointestinal tract as well. So once you see that start to degrade, then you're more at risk of developing inflammatory bowel conditions as well.
I think that this is the thing. And one of the points that for me, whenever I think from a clinical perspective, my starting point is usually to make sure that there are no issues around bacterial overgrowth. And the simplest way of doing that is to completely clear the bowels. And I think that I'm going to put together a nice sequence so people understand exactly what that means when I say that. So that because from a clinical point of view, what I have observed in a lot of patients who have unusual, strange patterns of disease, not adding up, odd neurology, palpitation, the usual stuff. Very often they have had in the past some kind of GI issue. And so they either have a CT scan or an X-ray, and consistently I will find that they have right-sided fecal loading. That means, and so they'll say, no, I'm not constipated. And I'll say, I'm telling you, I am looking at your scan and your whole right colon is overloaded.
Wow.
Now, when you think about that, and in a short while, I'll get an image as to what it looks like. You'll just reflect on the gut microbiome, the impact on health. What would happen if somebody has massive right fecal loading?
We want the stools to be coming through the bowel very regularly. We don't want any kind of fecal impaction going on, because ultimately that is waste product at that point. So we need it to be clearing through. You're going to start to see disruptions to the gut microbiome. You're going to see fermentation of potentially unfriendly bacterial species. Not only that, it could potentially interrupt the signals from the gut-brain axis as well. So the more metabolites you start to produce that are unfavorable in a colon that's not working effectively, the more that can contribute to some of the symptoms that we're seeing play out. Absolutely. Constipation is a huge problem. And I think to kind of put this into a bit more context of what we can sometimes see play out in clinical practice is that, people will say, well, I'm having a bowel movement every day, but they may alternate between this kind of diarrhea and constipation, or taking a little bit longer between bowel movements than kind of a standard 24-hour cycle. And what you generally tend to get with that kind of impacted colon, or this slow moving colon, is that water will start to be drawn into the bowel, and this is where you start to see looser bowel movements. So even if someone is saying, I've got diarrhea or I have regular loose bowel movements, they still can actually be constipated.
Absolutely. I've got this image here that I use in my presentation, and this person is really loaded, and you can see, but the point I'm making is that very often I will find that it's the right colon that is completely overloaded. You look at the transverse and the descending, and it's relatively clear. And those people will tell you, I'm not constipated. I'm moving my bowels okay. But they can't, because you only move your bowel from the distal third of the
what's
colon.
happening here then is, so you've got,
so in this person, they are loaded all the way through. This is ascending colon, transverse colon, descending colon, and they are just completely constipated. However, there is a lot of people who only have right-sided loading. So their hole from the cecum up to the liver in the ascending colon is full.
Wow.
And so when you think about that, and you think about then the metabolites and the toxins and so on, and all of this replication happening in the right side of the colon, no wonder they're sick.
Absolutely. And that could be nervous system, couldn't it? Coming.
Oh yeah. By this point, they are oftentimes having
Are they having
what we call colonic inertia. So
Yeah.
that's why it happens, is because their colon is just not working effectively, and they need help first to clear the bowel, then to stabilize it, and then hopefully over time you get an improvement in it. But this is a beast of a problem, and as I said, for people who are listening, and this is why I want people to respond. When I did my because I've been collecting these questions for a long time, and just to give you an idea from the hundreds of people who have responded, this is the kind of numbers that we're seeing. How long have you been experiencing your symptoms?
Yeah.
75% are over a year.
Yeah. I see people coming through who have been sick since 2020, and they've been through every single amazing healthcare specialist that you can imagine, and they've spent thousands on testing. They've done, I very rarely have to do much testing at all in clinical practice anymore, because people have collected so much data about their health and about their health markers. And I just want to kind of pull back a little bit on the whole important role of the gastrointestinal tract as a whole entity, and bringing in some of the medications that are used to support people with these conditions. Is that one that can have a very detrimental effect on the gut microbiome as well. So this is another thing that people don't necessarily take into consideration, is that the gut microbiome is able to do things to medications such as improve their efficacy or reduce their efficacy. And what's been really interesting from my perspective is that, say, for instance, someone's taking anticoagulation therapy. If you start to improve their gut microbiome, their medication gets more effective. And then you have to work on taking them off with, obviously, I work with doctors to do that. But there is, for instance, PPI, H2 blockers that are used a lot. That's going to have a very detrimental effect on overall gastrointestinal function, digestion and absorption, but also the gut microbiome as well.
That's a really important point. So in effect, when we think of the polypharmacy, sometimes with the older patients, who are on 15 tablets, they are chronically overloaded in their gut. You then manage to clear their gut of all of the stuff, and then suddenly all the medication that they are on improves in efficacy, so to speak. And so they can start, if they're on blood pressure medication, they'll start going hypotensive, and they'll think that there is something wrong with them, when it's just that actually now these drugs that they've been taking for 10 years are suddenly actually working properly.
Yeah. The more that you start to improve the gut microbiome, the less you need to have medication. And that plays out quite a lot.
So I'm going to take advantage of your celebrity access, okay? And I'm going to share with you a story that I worked on. Don't ask me why. Kind of like what happened with Mr. Beast. I see people who are sick and I think, okay, let me see how I could help them. And so I create the scenario almost like I have got access to them. Here is what I'm going to do. I want to tell you this story that I did. I did this maybe about 6 months ago. And I'm going to share with you what happened with regards to Celine Dion. I'm assuming she's not one of your clients.
No.
So what happened is that for those who don't know, she has SPS. I'll explain that in a little bit. But here is what I looked at with regards. I had to go through using AI to help me to get all this information. But here is what I found. In 2012, she had some kind of viral illness that affected her vocal cords. No big deal. Can happen to anyone. In 2014, then she had some throat infection. She had to postpone some shows. In 2016, she then had some unspecified issue with her vocal cords, plus she was stressed after the death of her husband. Sorry about that. And then in 2018, she had this middle ear condition. And so you can see all of these things are upper airway.
Yeah.
And what I usually say to people is that what I've observed for many patients is that with COVID long-term symptoms, there is a nidus of inflammation. Very rarely do I find someone who is perfectly well and gets these symptoms. What are your thoughts, firstly, with the prodrome period?
Oh, this is music to my ears, Philip, that you've done this workup, because this is exactly what I do in clinical practice. So it is really important to find out what has happened to a person prior to getting these long-term symptoms following an infection, or once they've experienced vaccination damage. So I do a really big deep dive on their health history timeline. So I'm going right back to birth, right back to their mother and father's health, because you can generally find, even when people say, I was really healthy before I got ill, you can kind of see a pattern. There'll be things playing out like overtraining, undereating. That's really common for women and for athletes as well. And it's interesting that athletes are a cohort that have been particularly affected. History of poor diets and, hectic work life schedules, and potentially heading towards things like burnout. But I feel that kind of things like previous illness, so if someone's had a food poisoning event, or there's been a traumatic event in the timeline, and even things like concussions and head injury, can potentially be some of the driving factors that can produce this, I kind of call it a shift in that homeostatic control towards a pattern of chronic low-grade inflammation.
Yeah.
And so, yeah, sorry, Philip, did you want to?
Yeah, no, that's fine. I was going to, because this ties in, just so that people are aware of what happened to Celine, is that she had this condition, stiff person syndrome, where they have lots of stiffness and spasms. The critical thing that stands out is this autoimmune disease. And what I've found, certainly in the pandemic, I've always been focused on spike protein autoimmunity, is that it unmasks underlying autoimmune issues. So meaning that if she had this and she was going to get it at 90, she'll now present with it at 55, and so it really unmasks these kinds of autoimmune problems. Any observations with autoimmunity in practice?
Yeah, so I feel that there's potentially a few scenarios playing out, in the sense of, I think potentially people are experiencing a hyperactivated immune system or a depressed immune system. What I'm seeing playing out recently, and in certain testing that I'm doing, is very, very severe immune depression, or immunosuppression. So I'm now starting to see quite significant low ratios, or low CD4, CD8 ratios. And this is really hugely concerning, because not only do we have the autoimmunity profile going on here, we also have quite marked immune suppression too. And really, it's about working out what's someone's big domino in amongst all of this. What's that big domino that needs to fall to then allow all of the other dominoes to kind of fall down and the person get on this road to recovery? And it's really important. I think the work that you've been doing, Philip, on autoimmunity is really important, but immune system testing is the key. Spike protein testing is the key. We need to understand whether there's spike replication going on. I would love to be able to do testing to see whether this bacteriophage is playing out in humans as well. That would be really important information, because what I see in my clinic is, when people come to me, they've done all the mold testing, they've done the Lyme testing and the interventions, they've done the helpapheresis, they've done the triple anticoagulation therapy, and there may be slight improvements in their symptoms, but they aren't recovered.
Yeah, that's the huge challenge, is that
Yes.
I usually say is that when you think of this spectrum of conditions, it's not a sprint, it's a marathon.
Mm-hmm.
And my way of explaining it is that I describe the symptoms. There's a specific image that I have used in the past that I think really captures how I think about it. And it's almost to do with the concept of the embers of inflammation being sprayed with petrol of the spike protein, and you just get this explosion. And so the problem is that what many people don't want to acknowledge is that they actually had problems before.
Yeah.
Yeah, they say, well, I was fine. No, you weren't fine. You just had subclinical inflammation. You just didn't acknowledge it properly. And so therefore what we have now is an exacerbation of that. If you don't address the embers, you can't get better.
Exactly. And this is really important, because if you do get someone to a point where they're starting to make a recovery and make a progress with their symptoms, you've still got to work on those underlying factors. You've still got to work on, if you're a person who is prone to overwork and overwhelm, that needs to be addressed, because you almost need to be kind of doing a whole life assessment, really. I mean, that comes much later on in someone's recovery, but those are the underlying factors that still will need to be addressed, even when someone is making a recovery,
Yeah,
because COVID's not going away. We
absolutely. This
could have
is
another pandemic come. We could have another outbreak of another disease, and so it's really important that people work on their immune systems. Part of that's working on the gut, but people are working on that immune tolerance so that they are more resistant and resilient to future kind of exposures to whatever virus there may be out there.
I'm gonna take you through what I think is the timeline for Celine. So we're coming back to Celine for a little bit. And so this is what I think happened in terms of the spike protein principle.
Mhm.
As I said, she already had pre-existing inflammatory issues with her throat. Then what happens is that in March 8th of 2020, she has her last full show. And what you have to notice is that the pandemic was declared on the 11th of March, 2020. So by this time, it's all over the world, in the USA. And where is she performing? New Jersey,
Uh,
Newark. And this had a severe outbreak of COVID quite early. Remember, New York was quite badly hit.
yeah.
And so she cut her show short because she had cold symptoms. What are the chances that this is not COVID? So this, in my view, is her first exposure to COVID. She was in a big event, lots of people wandering around, backroom staff, guards, somebody would have had COVID. And so therefore she would have been exposed in that period of time. So then in late 2020, the inflammatory process, she then starts to have the muscle spasms. The autoimmunity has been unmasked by infection. Then in May 2021, she's out promoting COVID vaccines. So, of course, one would assume she's getting them herself. And
Yeah.
by October 2021, she no longer does any performances.
Mm.
Shows have all been canceled. And by December 2022, she has the official diagnosis of stiff person syndrome. And to me, all of this is what I call the typical spike protein exposure profile, unmasking any kind of underlying disease. Any thoughts on that?
Yeah, I think it's gone beyond, is it natural infection? Is it vaccination that's causing this? I think it is really honing in on that COVID timeline to see exactly what's happened, which you've demonstrated so beautifully. And this is exactly what I do with my clients. I want to know exactly when their first infection or known infection was, whether they took vaccinations or not, what their symptoms were at that time as well, because I think that's quite important. Paradoxically, some people have experienced a recovery after having a vaccination. So this is kind of telling us that it was kind of stimulating those antibodies and creating that resolution. But generally, I'm seeing that there's a cohort of people from March 2020 who haven't still recovered, and there is a lot of people that I see that will have a reaction to a vaccine, but they will still carry on getting vaccines. And you can see the decline in their health history timeline, and you're kind of up to present day, and they're in full-blown kind of autoimmune or full-blown immune suppression.
Yeah, I think that just in case anybody who is a close contact of Celine is watching, let her know that we probably have the solution for her. Wouldn't you say, Rachel?
We can definitely support people. I think we have to be very careful about what we're claiming. But I think, part of what I do, it's not just about the gut microbiome. It's about getting people's circadian rhythms back online. It's about reducing inflammation. It's about, addressing any nutritional deficiencies. So there's a lot that goes into, how you would manage a complex case like this. You've got to break it down methodically and, work out exactly what it is that is going on for this particular person, which is why, spike protein testing is
It's critical, yeah. So, but here is the challenge now, because even though I agree with you with regards to spike protein testing, I think this is absolutely incredible. This is why I'm so fascinated with this idea. But my question still remains. We identify they have spike protein exposure, circulating spike protein from a simple blood test. We then find a strategy that can remove it, and we show that the spike protein has been removed. So this is what they're trying to do. What happens on the next exposure?
Well, I think it depends on how well you can bring the immune system back online, and that's going to be a case-by-case situation, and it will depend on how well someone is invested in continuing to build on that immune resilience. So theoretically, if you can support the build back of the gut microbiome, you can protect the oral and the nasal cavities, you can optimize digestive function, because don't forget, things like stomach acid and bile, they play really important roles in addressing any kind of onslaught of microbial species that shouldn't be coming into the gut as well. So there is so much to look at in individual cases, and it's so personalized. But ultimately, I do believe that you can bring the immune system back online if you can get rid of the spike protein and know that that's kind of not replicating in the background and doing the damage. There is still work to be done after that. I don't think clearing of the spike is going to be the cure of everything, because like you say, people have come into this having kind of a predisposition. So when they get another infection, are they more likely to go right back to where they were before? I just have no idea. But I think if you can build resilience as much as possible, there's a good chance that they will kind of deal with it appropriately.
Yeah, I think this is a really important point, and I think especially because as I say to people, I tend to be quite COVID focused, in the sense that I look actively for it. When I see a patient, if things don't make sense, I then try and look for the timeline. And at the moment, what I'm finding, and it's purely supposition because you don't have a test, but but I'm seeing it so consistently that people have mild symptoms. The most obvious symptom they have is fatigue, significant fatigue.
Yes.
They just feel shattered for a couple
Mhm.
of days.
Yeah.
Sometimes they have a little runny nose, sometimes a little bit of a sore throat, maybe a bit of hot and cold, and then
Yeah.
they're okay. And
Yeah.
then 2 weeks down the line, they're starting to have unusual presentation of disease that doesn't
Yes.
quite add up.
Yeah. Yeah, absolutely. And I feel that that the gut microbiome is playing a really big role in that.
Yeah, and so it is hugely challenging now. And what we need, I think, as we're coming to the close here, Rachel, what I think we need is that we need to find practitioners who have an interest in this, to lead the charge of trying to understand what we're seeing. I mean, it's been so valuable to talk to you about what you are observing and to reflect on what I'm observing and to try and pull this together. Imagine if we had a team of people regularly meeting with an interest, talking about cases, just like a multidisciplinary discussion to hone ideas to try and understand. Why can that not be done?
This is something that I have been really pushing, particularly in other podcasts that I've been doing with other people, is I've been desperately trying to work out how that can happen. What I see is there are so many amazing practitioners, doctors, medical professionals, researchers who are kind of doing their own thing in their own speciality, but there's nothing that's bringing all of that together. And you can see that playing out when you see these complex cases coming 5 years down the line. They've been to gastroenterology, they've been to neurology, cardiology, immunology, and no one's putting those pieces together. And I think there is a very big need for some form of collaboration to happen where we can research, we can present case studies, we can discuss complex cases. One, because I think heads together is the best way to manage these complex cases, but also to try and get some more research into this as well.
Excellent. Yes, I completely agree. I think we let's see if we can make this happen, Rachel. Let's see if we can find the people who are willing to do this.
Yes.
Pull them together and let's build a way forward, because this is so complicated, and I've been in this space researching it for 3 years now. And I remember when I started, I thought, come on, this has got to be straightforward. This is the most complex disease I have ever seen. And it's going to take all of us working together to be able to find some kind of solutions. I want you to give us a last word of hope, Rachel, as we close out. What is it that you would want to say to the audience?
I just want to say that I'm seeing some significant changes to people's health by doing some really quite simple interventions. And I think if you can get someone to look at your case history with a 360-degree view, it's so much more helpful to just pull all of that information and data together that's been collected, and then to have a strategy that can be very easily implemented but built upon over time. I think when we came into the pandemic, people wanted a quick fix solution. And I think it's become really evident that there is no quick fix solution. However, if you can reduce inflammation, if you can start to realign your circadian biology, if you can start to connect in with simple things like nature and start to address things within the gut microbiome, then things start to get a little bit easier. It's not, I'm not proclaiming that there is a cure, but there has been some incredible healing in my clinic. And I work with doctors, I work with other healthcare professionals. So I'm not just on my own. I do form part of a multidisciplinary team. So there is lots of support out there. You just need to find me.
Excellent, excellent, Rachel. So, for those people who are watching, who are concerned, I am building the numbers. Don't worry, even though once you sign up to the link in the description, if you're interested in understanding more about the spike testing, which we're trying our best to see if we can bring to you, please click on the link, fill out the survey, and we'll be in contact to try and give you some more education. Thank you very much, Rachel, and I want you to wait with us for the outro. Thank you all for being with us, and we look forward to bringing you more information in the near future.
Thank you.